Welcome back to my channel and welcome back for another edition of Health Class. Napag-usapan na natin before ang tungkol sa poop at kuko, kung paano ang mga poop at kuko nakapagbibigay ng impormasyon sa ating kalusugan. Ngayon naman, pag-uusapan natin ang tungkol sa urine or pee or ihi. Paano nga ba nakapagbibigay ng impormasyon sa ating kalusugan sa pamamagitan ng ating ihi? Ano ang kulay ng ihi ang healthy? Interesting na topic ito. Kaya, huwag mong pigilan ng ihi mo. Punta ka muna sa CR at pag-usapan natin ito. My name is Ryan, and I'm specializing in diabetes, men's sexual health, primary care, alcohol and drugs, and alternative medicine. Nagtataka ba kayo kung bakit paminsan-minsan nag-iiba ang kulay ng ihi ninyo? Gusto nyo bang malaman kung healthy ba ang kulay ng ihi ninyo? Unahin na natin kung ano nga ba ang urine or ihi. Ang urine or ihi ay isang waste product ng ating katawan na dapat alisin sa ating katawan. Alam nyo ba na ang normal na color ng ihi ay yellowish? It can also be a clear yellow to slightly orange. Ang kulay ng ihi ay nagdedepende kung hydrated or dehydrated ang isang tao. At naapektuhan din sa klase ng gamot na iniinom ng isang tao at sa type ng mga pagkain na kinakain ng isang tao. At syempre, maraming mga health or medical conditions ang nakakaapekto sa kulay ng ating ihi. What can the color of your urine tell about your health? Alamin natin yan, isa-isa. Sabi ng Cleveland Clinic, kapag ang ihi mo ay red tinge or may dugo, it can be a sign of UTI or urinary tract infection or kidney stones or in rare cases, a form of cancer, commonly kidney, stomach, or prostate cancer. Pag reddish-purple naman ang kulay ng ihi niyo, it can be a sign of lead or mercury poisoning. Pag tea color naman, it can be a sign of kidney disease. Pag orange naman ang kulay ng ihi ninyo, it can be a sign of liver or bile duct problems. Kung green or cloudy naman, it can be a sign of urinary tract infection or UTI. Pag brown naman, or if it smells like ammonia, it can be a sign of liver failure. Pag medyo naman matamis ang amoy ng ihi ninyo, it can be a sign of diabetes. Paalala lang that if you notice a change in color of your urine, you need to consult your doctor for proper assessment and diagnosis, especially if you are also experiencing symptoms such as fever, chills, fatigue, pain, or burning sensation. Sabi naman ng Bangkok Kidney Center, pag green naman ang color ng ihi ninyo, it can be that you're eating a lot of asparagus. And it can be a sign of bacterial infection. Pag blue naman, it can be a sign of hypercalcemia or mataas ang level ng calcium. Or pwede rin baka nakakain kayo ng pagkain na mataas ang level ng blue food coloring. Pwede rin na baka ang isang tao ay umiinom ng mga gamot kagaya ng indomethacin, amitriptyline or propofol. Ang mga tabletas na ito ay nagkukos na maging blue ang urine ng isang tao. Pag purple naman ang kulay ng urine ninyo, it can be a UTI or urinary tract infection due to catheter inserted. O, na-check nyo ba ang kulay ng ihi ninyo today? Normal ba ang kulay ng ihi ninyo today? Comment down below kung ano ang kulay ng ihi ninyo today at re-replyan natin yan kung ano ang posibilidad na dahilan. Nagtataka ba kayo kung paano na-form ang urine or ihi? Paano nga ba nafo-form ang ihi o urine sa loob ng ating katawan. Panoorin natin ang short video na ito.
Our kidneys play an essential role in urine formation because kidney cells called nephrons have natural ability to filter wastes and extra water from blood in producing urine. Nephron cells complete urine formation in 3 steps, including glomerular filtration, tubular reabsorption, and tubular secretion. Glomerular filtration. Blood enters the nephron cells at glomerulus region, where increased blood pressure causes extra water and solutes to filter into the Bowman's capsule and enter the nephron tubules. The glomerular membrane has 2 small size pores that prevents movement of large proteins such as albumin from blood into the nephron. Tubular reabsorption. The filtered wastes enter the tubules of nephrons from glomerulus, where excess water and solutes are reabsorbed back into the blood as per the body needs. This helps in maintaining quantity of ions in the body. Tubular secretion. In nephron tubules, if water and solutes are reabsorbed into the blood on one side, the remaining wastes also enter the nephron tubules from blood on the other side. This process is called tubular secretion. At the end of this process, wastes and water combine to form urine, which contains 95 water and 5 wastes. The urine color is white if it contains excess of water, while urine color is dark yellow if it contains low volume of water. Urine from nephrons moves through collecting ducts, pelvis, and ureter and stores in the urinary bladder. In normal humans, the maximum capacity of urinary bladder to store urine is 500 ml. And if this volume exceeds, it is much difficult to hold a urine further.
Sana hindi kayo na-confuse at na-bored ha. Yung video niyon ay ang more scientific and medical way of explaining how urine is formed. Pero sige, simplihan natin. Ang next video na ito ay napakasimple na explanation kung paano nga ba na-form ang urine inside our body.
The main parts of the urinary system include 2 kidneys, ureters and bladder, and a urethra. The kidneys are 2 bean-shaped organs. All of the body's blood passes through it, and it filters the blood and waste liquid is changed into urine. The kidney is made up of several small cells called nephrons that are like small filters. They keep all the nutrients and good blood contained and convert waste into urine. From the kidney, this urine goes into 2 very thin tubes. These tubes are called ureters. From the ureters, it goes into a balloon-like organ called the bladder. When the bladder becomes full, then you feel like going to the washroom to pee. From the bladder, it passes out of the body from a part called the urethra. Oh, it seems your bladder is full too. Do you want to go to the washroom? Can you hold it in for some time? Do you know which muscle helps you to stop pee for some time? There is a muscle lining around the bladder called the sphincter. It stops and holds the flow of urine until you reach the washroom. Okay, go empty your bladder now.
Alam niyo ba na pwede niyong i-check ang kulay ng urine niyo sa bahay? It is recommended to check your urine color twice a day. You can check your urine first thing in the morning. Napaka-importante na i-check ang urine color ninyo sa umaga dahil expected na ang urine sa umaga ay more concentrated. At i-check ang urine ninyo bago matulog. It is expected na ang ihi ninyo should be clear to pale yellow. It is also recommended to have a urinalysis every year. Ang urinalysis ay isang urine test that can screen and monitor certain common health conditions such as liver disease, kidney disease, and diabetes, as well as urinary tract infection. It can detect not only early signs of disease, but also the presence of red blood cells and white blood cells that can reveal whether you have a silent infection. There you go everyone. Oh, huwag nang pigilan ng ihi ninyo kasi hindi din yan healthy. Uminom ng sapat na tubig kada araw. At kung worried kayo sa kulay ng inyong ihi, ay kumonsulta na agad sa inyong doktor. Thank you for watching. I shall see you again on my next health class. Stay safe and be healthy.